Does charting in medicine seem overwhelming? The queue of messages, labs, patient calls that never seems to get smaller? The pile of pre-authorizations awaiting your input? The tens or hundreds of charts that you still have to finish and sign? It's exhausting, right? And still, all you want is to be able to go home with your work done, to be able to spend time with family, hang out with friends, practice self-care. I want to invite you to join me for a 6-week-long coaching program, Charting Mastery, where you will get equipped with the skills and approach that you need to get home sooner and leave that work at work. To check out more info and to join the waitlist, head over to chartingmastery.net. You will be among the first to hear when the doors open so that you can join me on this journey. There will be opportunities to reflect and earn CME after the different sessions as well. And now on to today's show. Welcome to the MedEdWell podcast, empowering physicians to get work done at work and then be able to reflect and choose what is important for both their life and medical practice. I'm your host, Dr. Ryan Stejink, general pediatrician and life coach for physicians. Hello, everyone, and welcome to another episode of the MedEdWell podcast, where physicians come to be encouraged and equipped to take the next step in their own wellness journey. Thank you so much for subscribing and sharing these episodes, and for engaging with these concepts to advance wellness for yourself, your patients, and your colleagues. Today, I'm excited to be joined by Dr. Alicia Shelly, who is a board-certified internal medicine and obesity medicine physician with Wellstar Medical Group in Douglasville, Georgia, just outside of Atlanta. She is the host of Back on Track, Overcoming Weight Regain podcast and YouTube channel. She is a fitness enthusiast and has completed 6 marathons and an Ironman 70.3 or half Ironman. She is currently training for her first full Ironman. Dr. Shelly, thank you so much for being here. Welcome to the podcast.
Thank you so much for having me. It's such an honor to be able to talk to you today and to talk to your audience as well.
Thanks, Dr. Shelly. Why don't you tell us a little bit more about yourself and your journey to medicine?
So my journey to medicine. So it's kind of funny. I think, when you're a kid, you're like, I want to be an actress or I want to be a school teacher. I think for me, I've kind of always wanted to go into healthcare. My mom tells me stories of how she was sick and I would like make soup for her. I'd have my little pretend stethoscope listening to her heart. So I think either they brainwashed me at an early age or it's just something I naturally kind of grew into. And even though I changed my mind, like I really wanted to be an actress. And then they were like, so a majority of the time you start off, you're waiting tables until you get that big break. And I was like, what? Oh no, I need some job security. And I really did enjoy not only just helping people, but the mental, I guess, rigor of medicine, because it's not just you're helping people, but you're doing it in a totally different way. You're really thinking through the disease process. You're taking people's symptoms and saying, okay, it's this. So you're doing a lot of mental work, gymnastics to kind of help people feel better. And so I have to admit, it's been very rewarding for me to be able to it's an honor to be able to be in this position to be of service, but then also it's rewarding to be able to help others and to just be a part of people's lives. Like they allow you to come in like in the good, the bad, the ugly, and you're seeing people at so many different stages of life. And it's truly an honor.
Yeah, really well said. I think just that honor and that service but also that intellectual rigor that really can just be so fulfilling when you really get to bring that all to bear as a physician.
Definitely.
So tell me a little bit more about how you got into practice and then how your wellness was threatened and what ultimately led you to burnout.
Yeah. So I entered into practice in 2014. beginning of January 2014. And I actually, the first boss, the first practice I started with was just excellent. He really mentored me. He allowed me to grow. And as I was just building up my practice, I have to admit, when I look back at it now, I realized that I was a perfectionist. Instead of delegating more, I was like doing things myself because I thought I was the only one could do this. I had to, I mean, I'm not saying you shouldn't look through all your labs, but I had to look through the labs. I had to write a detailed message on what each and every lab is. So this notion to be perfect, notion to be able to like explain everything to the T. I would get behind in clinic. And not that it's okay to get behind. I'm not saying you shouldn't, but I would get behind just with the, regular follow-ups, trying to just give my all. And what I found was that I started to get burnt out. Not only was I behind on my notes, I was behind on my labs, I'm behind on my messages. I mean, let's not even talk about doing prior authorizations. It was like a big old stack on my desk. And I was the only one that could do prior authorizations. Like I didn't delegate to people. And so it got to the point where I was just dissatisfied. I wasn't happy where I was. I'm like, can I be in primary care forever? I didn't mention I'm a primary care and obesity doc. So in my primary care practice, I work 3.5 days of primary care and then 1 day of obesity medicine. And so I'm like, I don't know how I'm going to be able to last. Like it's only been a couple of years and I'm still wondering thinking maybe I should jump ship. And so I have to, so I think those certain characteristics that I had kind of caused me to lead to burnout. And so I thought that, hey, let me change jobs. Maybe it'll be better on the other side. The grass is always greener on the other side. And so I left my first practice, went to a different practice that had more people, more staff, more help. And I found, now granted, it was during COVID, but I did find that after the first year, I started to get burnt out again. I started to get behind in my notes, behind in my labs, like the same thing was continuing. And, I asked myself, something has to give. This is not the work, because the work is the same, whether in my first practice or in my second practice. There's something internally that's going wrong. And that's when I fell in with, I had started exercising before. So let me get wrong. I started exercising before and it helped with kind of managing the burnout because it was a stress reliever. But in May of 2021, I realized that I needed coaching, life coaching. And so there was a burnout coach. And by working with her, I was able to see kind of internally why, I'm burning out. Why is it that I have to be so perfectionist? And then that is so funny because sometimes one coach, it also led me to another coach where they helped with kind of honing in on the framework of your, not just the framework of your notes, but just the framework of how you can improve and be faster. And you have you have people, you're delegating more to people. Now the thing that caused my burnout, the fact that I had, so many outstanding notes. I mean, at one point I had 400 labs, okay, 400. So, if anybody who's out there that understands, it was really bad. So, I've gotten to the point where each time I'm in clinic, I have to finish my notes. I can't leave without finishing my notes. And so I'm finishing after every patient. And it really helped me to be more efficient in the clinic so that I can be able to recover outside of clinic. Like I can use my off time as my off time, not just, let me catch up time. So it really made a difference. So I think that in 2021 is when I really realized how being in balance, not just with your emotional, but physical health is important as well.
Thanks so much for your vulnerability and sharing. I think this is so common, and yet sometimes it's easy to feel feelings of shame and like, I bring things home, or this pile of prior authorizations, or the backlog of notes or labs. And it feels overwhelming.
You're absolutely right. And I would sometimes think of myself, you're a bad doctor. You're a bad doctor because you didn't respond to this message within 2 hours, or you're a bad doctor because, the labs are still outstanding. No, mind you, I had 400 labs. So yeah, I may have been a little bit of a bad doctor, but you know, but still, it was like you said, the shame, the guilt that you feel, and what I found was because I felt so guilty, it developed anxiety. I didn't want to even touch the labs because I'm like, oh gosh, what does this mean if I touch, like I just felt like so bad that, oh, you're such a bad doctor that I didn't even want to just touch it. It just caused so much anxiety and stress.
Well, and I think it's the things that got us into medical school, got us through medical school, those hardworking, I can do it tendencies are real easy to bring into the never ending, what seems never ending stream of labs and notes and the next 15 minutes. And so I think that's really helpful, just whether it's getting coaching or just examining your thoughts and the stories that we tell ourselves around. It's like, okay, I can actually take an extra 2 minutes in the room after I've signed the orders. The staff is getting things ready, and I just can tell them, hey, I'm working on my notes. And especially as I see teenagers, and I'm like, you wouldn't want to bring extra homework home, would you? Neither do the doctors.
No, that's so true. And you're right that we do tell ourselves these stories, and we do tell ourselves like these negative thoughts that we're thinking that, hey, I'm a victim here because I have so much and I don't have a life outside because of the fact that I'm having to take my work home. And so I found that to be the case myself, where it was so sad. I was talking to one of my friends from medical school, and all of our conversations were, how are your notes? Like, wasn't like, oh, what are you doing? That's fun this weekend. It was like, so are you catching up on your notes this weekend? Like what? Like it was really like this was a way of life. And it doesn't have to be. It doesn't have to be.
So by examining your thoughts and getting coaching, but then you said exercise really helped you as you worked through this and fought through burnout and supported your wellness. So tell me more about that.
Yeah. So what I find is that, like I mentioned, with the burnout, I also experienced some anxiety. And so a lot of times, what most people understand is that when you have that anxiety, it could just build up if you don't release it. And you're just kind of sitting there just shaking because you're just that anxious. And so by exercising, at first I started off with just running. I would run maybe 3 days a week, have a long run on the weekends and then 2 days throughout the week, do a short run. And I found that it gave me an outlet. I wasn't always like worried about my labs or worried about my notes. I was actually doing something else that kind of took my mind off of it. So it helped me to maintain. I think I probably was in burnout for like several years. Like it wasn't like, oh, all of a sudden I decided this. No, this was something that I had been suffering with probably in silence for several years. And it took me some time to figure out what's the next step. To not, let's say, feel guilty or shameful that, oh, I'm the only, and in my mind telling myself I'm the only doctor that's going through this. And it took some time, but I had started exercise or running in 2016, and it just kind of helped. It gave me an opportunity not only with being healthy and feeling better, but it was a really big stress reliever, and it allowed me some self-care time, which is also important when you're trying to battle burnout.
Absolutely. And that's really a good reminder that just prioritizing that self-care time, and whether it's going on that longer run or playing music. I play piano, and it's just sometimes fun to have some totally different outlet. And whether it's a hobby or spending time with people, friends, family, it's just slowing down and saying, what are my priorities? And because it's so easy to get caught up. And I think one of the big things for burnout in my experience was just that lack of ability to really recharge during that off time, whether it's a weekend or whenever you're not on shift.
It makes a difference to be able to recover because you find that you're waiting for the weekend gets here, and then you're like, oh my gosh, I need another day, And so having that recharge, it makes you happier. It makes you, ready to go. I was talking to a colleague today, actually, and we were like, I wonder if I'm a better doctor on Monday than I am the better doctor on Friday. Because on Friday, you're kind of drained from the week. You're just trying to get to the weekend. And then the weekend comes, you're like, oh yeah, the weekend's here. And then Monday you're like, well, I'm refreshed, or the opposite. I'm just drained from the weekend. And so it just kind of makes a difference. And it makes a difference in how you practice too. Because when you're burnt out, you're just kind of trying to phone it in. You're trying to make it to the next patient. And people can see through that when you're maybe not as interested or you have something on your mind. They can tell. They can tell.
Hmm. Yeah, they can see that you're rushed or you're not listening as well, or when they bring up that one thing as you're about to walk out the door.
No, that happens all the time.
Hmm. And then it's like, how do you choose to manage your own mind and how you respond to that? Because those thoughts can be challenging.
Yes, yes, they can be. Mhm.
So you found exercise and running, but then you got into marathons and are now training for a full Ironman. Tell me more about that process and how you got interested in that.
Oh, yes. So the funny thing is, I was never athletic at all, never athletic. And in fact, I only got into running, like I said, in 2016 because my friend was like, hey, let's do a 5K. So we did the Couch to 5K app. And then every year in Atlanta, they have this a 6 mile or 10K on 4th of July called the Peachtree Road Race. And my friend was like, hey, let's train for that. So we did the Couch to 10K app. And then after, just putting like with those apps, you're exercising maybe 3 days out the week. And I just realized this was such another way how to exercise and I enjoyed it. And so I was like, okay, let me try the half marathon. The half marathon kicked my butt because there was well, maybe there was a Couch to half marathon, but I did not use that app. So I wish I had because that half marathon kicked my butt, but I finished it. And then I had a couple other races, half marathon and 10 mile already paid for. So I'm like, well, let me try to train for it because I don't want to lose my money. And actually I ended up loving it, loving it. And then they, of course, with the different, it was Atlanta Track Club with these different run clubs, they have different promotions. And so they said, hey, if you did the Peachtree Road Race, if you did the 10 miler and you did the half marathon, you can do the marathon, which would be the ultimate peach, and you get something special. And so, of course, they didn't tell you what that something special was. And I was like, let me train. I've always wanted to do it. So knowing that I need to train, I joined a training program at the Atlanta Track Club, and the rest is history. I fell in love with marathon running. I loved just the person you have to become in order to finish that race, which is somebody who's consistent, somebody who is continuing to go, making sure you have your nutrition together. And so eventually I was able to do over the years 6 marathons. And then I realized I need a challenge. I need more of a challenge. And so for the last year, I've been training for an Ironman, which is in September. So I have a few weeks to go until this Ironman, but it's been a great challenge. It actually is more than, of course, with anybody if you're not familiar with an Ironman, it's basically a triathlon where you have 2.4 miles of swimming, 116 miles of riding your bike, and 26.2 miles of running, all on the same day within 16 hours. My goal is 16 hours. I think it's 16 hours and 30 minutes is the time cutoff. So that's what my goal is, 16 hours and 29 minutes so that I can finish. But it is a challenge and the discipline that you have to have. And that's when I realized I had to do something more than what I was doing because I was spending a lot of time working outside of work and I needed to focus on the Ironman. I need to be able to do my activities, my exercises, because usually with the Ironman, you're exercising twice a day in the morning and at night. And so it makes it somewhat difficult to have like this burden of notes to do or labs. And so that's when I sought out my second coach who kind of helped me with conquering the notes and the labs.
That's amazing. Well, and just to see that the confluence of the working out, the going for goals, the mind work that you needed, and then just realizing, okay, in order to have that space to use that discipline, you were then in getting that second coach able to apply those same disciplines to your charting and your workflows, and it all kind of has come together. And here you are just weeks away from finishing your first Ironman.
Yes, yes. And you're right. The funny thing, the different tools and the different mindset that you actually develop while training for the Ironman, you use in regular medicine life, you know? Because there's some days when I don't, I'm tired. I don't want to go to work. And I use that, hey, you can do hard things. Just keep going. Just show up, you know? So different affirmations that I use in the Ironman, I use too with my work. And it helps me to kind of avoiding burnout because I realize that when those negative thoughts start to come, I can be able to change them to more positive thoughts to kind of help me get through that moment.
Yeah, thanks. That's so huge. And just looking at it's like, even if others listening aren't training for an Ironman, as I am not, it's like you can still realize it's like you've done hard things. You've graduated medical school. You might be in residency or in your first attending job. These are all things that looking back, you can say, all right, I've done this and I can apply it here. So things you've done in going for a marathon and then a half Ironman, it's like those all come together in just your life and your medical practice.
Oh, definitely. You're absolutely right. It all comes together and you can all use it. You can all use it. And it's been very helpful for me too, as well.
That's so cool. So, what advice would you have for other physicians out there right now? Something that maybe you wish you knew earlier in your career, maybe even when you were still in training, that might help them in their journey right now?
So definitely, and you may not suffer with how I did with my notes in my labs, but the one key thing that really made it difficult for me was my perfectionism, having to be perfect. And so I would tell you it's more about progress, not perfection. Make sure that you're showing up every day, but you don't have to do it perfectly. When you're in medical school, they teach you how to write your soap note. And then, you go on your rotations and they're like critiquing your soap note. So in your mind, you're like, it has to be perfect or they're going to critique me. They're going to read this note and blah, blah, blah. But when you become an attending, you realize literally what people care about are the assessment and plan. They're like, what did you do? What's next? Where do we go from here? Like that's what people care about. I mean, rarely they kind of look through the HPI. So, you spending like hours trying to craft that perfect note, you don't have to. You don't have to be perfect. It's okay to do your notes anyway, to let that be not as perfect or be work, shall we say. And sometimes you have to give yourself grace because that's where I stopped, where I wasn't allowing myself grace. I was just beating myself up for not being the perfect doctor that I thought I was in my mind, or that the perfect doctor that I wanted to be or strive to be because, oh, I didn't answer this message, within the 24 hours. And as long as it's not urgent, I think you're fine. So I would say my advice to you all coming up is, you don't have to be perfect. You don't have to craft that same note, but you definitely want to be able to finish your notes in that day. Like, don't take stuff home, like finish it after each patient. Even like you said, even if it's half, a minute or two. What I found is like one of my frameworks is that I use a little timer in the room because I tend to talk and just chat, 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 chat. And before you know it, we're 30 minutes over and now I'm behind a whole hour, so I use a little timer. And the one thing I realized is that I time myself in between the patients. So where I finish their notes, and it may take me like 1 to 2 minutes to finish the note and close it. But if I were to take this same note and sit down like after work, it takes me 30 minutes, 15 minutes to close this note. Why? Because I'm trying to remember what happened. I'm like, what was I thinking? What did they say? So it's better I would say for those that are coming up, finish your note after every patient. People will wait. They'll just be on their phones while you're finishing your note. It's just 1 to 2 minutes. They won't notice. They won't notice.
Uh-huh.
But, just make sure that you're also taking your time for yourself to recover and have that self-care time.
Those are such great insights. I think I'll have to go back and listen myself because just those things that it's really helpful to remind yourself those positive thoughts because it's so easy to, yeah, talk negatively to ourselves, like to those feelings of shame and guilt that can be so isolating. And even just acknowledging that it's like so many of us face them, and just reminding ourselves of these things, I think can be really helpful in supporting one another. So thanks so much for sharing those.
Oh, you're welcome. And thank you so much for having me.
It was an honor to have you join us, and I wish you all the best with your Ironman coming up.
Thank you.
Thank you so much, Dr. Shelly, for joining me on the MedEd Well podcast and sharing such amazing insights to help other physicians in pursuing their own wellness and to prioritize that self-care and caring for your own health and wellness. For all of you listening, I want you to consider how you can apply what you've learned from Dr. Shelly in today's discussion. And then please share this podcast with another doctor in your life and subscribe to the podcast. You can help change the culture of medicine and promote wellness for your patients, your colleagues, and yourself. Thank you so much for all that you do, and have a great day. And now for our important disclaimer. Dr. Ryan Stedjink is a practicing general pediatrician, but the MedEd Well podcast does not reflect the views, opinions, or belief of his employer nor his affiliated university. Additionally, the MedEd Well podcast is for educational and entertainment purposes only and should not be considered advice regarding financial, legal, student loan, medical, or any other specific topic. In such a case, you should seek consultation with a certified professional in that particular area. Again, thanks for joining us on the MedEd Well podcast, and have a great day.